I decided to become a physician because I've always been interested in science, and that started when I got my master's degree and did benchtop research. And I found medicine and medical science very interesting, but through doing benchtop research, I realized something was missing, which was the patient care and getting to know people. And I followed actually a neighbor of mine was a family physician, and I followed him a few days in clinic, and I kind of saw how the aspects where you could apply science to treating patients and getting the best of both worlds. And so then I applied to medical school, and the rest is history, but I still have the science background, but you get to add the patient care with it. What I enjoy most is both interacting with people and solving problems. I've explained it to some people before, whether it's students that have followed me or even my wife when she was in training, that each patient is like another puzzle that you're going to solve. You could go from a headache in one room to diagnosing cancer in another room, and you never know what to expect. One frustration some people have with their jobs is that they get to be mundane and do the same thing every day, and every single day is completely different just based on who's on that schedule. And it's always interesting in that regard, and there's always something new that we have to learn because medical science evolves day by day. My philosophy of care is twofold. One is I'm very big on preventive health care. I'm very big on trying to prevent the disease state before it either progresses or it manifests itself. And diseases such as diabetes or heart disease, where you can promote healthy eating, exercise, and weight loss before it comes on, where you can promote preventive screening such as colonoscopies, vaccinations, well-woman exams, and other before there's an illness. Then my second approach is that I'm more the type that I give people options. I feel like I know that when they come to see me, they've probably already gotten on the internet, they've researched things, they know a lot about their care, and you just have to kind of direct them as to the best option. But I do give people options. I tell them this is one option, this is the other. Maybe I give them my opinion, but I'm not the type that tells them this is the way it's going to be and that's it, because I feel like people should have an active role in their medical care. What I'd like my patients to know about me is that I am a family man, and that I have a lot of medical experiences myself. I have 2 children, and I'm married, and I learn each day with those things, especially when I take care of kids in my clinic, things that I've learned that I didn't ever even learn from medical school. Just that I've been a patient myself. I've been in the hospital myself. I can definitely empathize and sympathize with a lot of medical problems people have gone through because I've been on the other side of it, and in some cases I'm still on the other side of it, and I just want them to know that I understand what they're going through, and although I'm the physician on the other side of the table, I'm either actively or not quite literally holding their hand through the process as much as I can. My main advice for patients would just be for them to be honest and to be forthcoming with what their problem is. One example would be every patient, when they come in for a problem, for example, back pain, they might want relief of the pain. They might just want to know that it's not cancer. They might just want therapy, but just to be honest and to work with their doctor on a treatment plan, because I feel like both their opinion and the doctor's opinion should all be considered when they come up with the right plan of care for them. I would describe my practice as a practice of seeing the entire family. We call it family practice, but whether it's giving vaccines to children, performing well-woman exams, or taking care of the elderly in or out of the nursing home, we provide care literally from what we say, the cradle to the grave. We provide care of all ages, which is what I love about my job, in that you get to see a 2-week-old baby in one visit and a 95-year-old person in the next visit, and you never know what that schedule is going to bring, but you can follow people through their lives as they're growing older, as medical problems may come on, and doing your best to keep them healthy and fight off any medical problems that may show themselves.